2 o'clock, April 3rd, House Healthcare. And we have Legislative Council. We're gonna do markup on one bill and possible vote. And some possible votes on 2 more. So we're gonna start with S27.
All right. Good afternoon, Jen Carby from the Office of Legislative Counsel. We are looking at S27, which I have prepared as a strike all amendment so that I can show you your potential changes in context. You can decide how you would want to proceed, if you would want instances of amendment or a strike all if you have other changes to make. This is S27, an act relating to medical debt relief and excluding medical debt from credit reports. And these are 2 suggestions recommended by the Office of the Healthcare Advocate. So the first one is in section 1, which is where in the bill it appropriates $1 million to the treasurer to contract with a nonprofit entity to acquire and repay certain medical debts incurred by Vermonters. And it requires the treasurer to ensure that the entity with which the treasurer contracts will do a few things. Will purchase the medical debt of eligible debtors from healthcare providers at fair market value, abolish the debt with no cost or tax consequences for the debtor. And then because I'm adding a 4th one, I struck out and coordinate with the healthcare provider or collections agency to ensure that any adverse information resulting from the medical debt is removed from the debtor's consumer credit report following the contractor's purchase and abolition of the debt. And then I've added a number 4, notifying each individual whose medical debt was abolished pursuant to this section, the amount of the individual's medical debt that was abolished and the name of the healthcare provider or providers from whom the entity purchased the individual's debt. Second, the estimated percentage of the federal poverty level that corresponds to the individual's household income. And third, the availability of financial assistance policies at all Vermont hospitals in accordance with law passed by the Healthcare Committee a few years ago and the General Assembly in 18 BSA 9482, including the following minimum discounts: a 100% discount for individuals with household income at or below 250% of the federal poverty level, and at least a 40% discount for individuals with household income between 250 and 400% of the federal poverty level. And I will just notice there's a little bit of a simplification from how it actually is spelled out in statute, because there's, I think in the net result is the same, but there are different things getting discounted if a person does or does not have insurance. But the result is what comes out of their pocket.
Basically, in the letter, we're just advising people that here's how much, here's why you qualified, and going forward, just to let you know that Vermont has this thing. Everybody good with that?
Yes.
Questions? Okay. Oh, Leslie?
I'm just thinking border operations. I just want to understand. So what's happening first is a person unfortunately incurs this debt.
Right.
They then get the C, availability of financial.
No, this is really telling people for future reference, here's where you fall in federal poverty level and you may qualify based on that for.
Okay.
Financial
So that's what I'm
assistance.
not understanding. So it was like this debt's been paid off, and just so you understand, as we go forward, you might.
You might avoid accruing a similar debt.
Okay.
So, sorry, going forward, we might avoid it. We don't know how long the money's gonna last.
Right. So again, this is notifying anybody whose debt was abolished, how much was abolished and from where, what their percentage of federal poverty level is, and the fact that there are financial assistance policies at all Vermont hospitals for
Okay.
people based on their percentage of poverty.
Okay, sorry, I misunderstood. Not that they're gonna get to that.
We're just letting you know that in the future, you could avoid this because all these.
Great, thank you. Yep.
And maybe it makes more sense to flip it around a little bit to say that financial assistance policies are available at all Vermont hospitals in accordance with just sort of more of a, so it's a little clearer that it is information.
So you're saying get rid of.
I just flip it around.
A little.
Nope, I would just say in C, instead of saying the availability of financial assistance policies, I would just reframe it to say that financial assistance policies are available at all Vermont hospitals in accordance, and I keep all the rest of it. But just, I think since there were a couple of members who were confused with the way it was laid out, I'm trying to think of a way that might be a little bit.
But this isn't what's gonna be on the actual notice. I mean, someone's gonna wordsmith the
He
information.
is gonna wordsmith it, but I'm just, if
Yeah.
people are having trouble understanding what the intent is, then I'm concerned the wordsmither will go down the wrong track.
Okay, that makes sense. Anyone opposed to Jen
No.
making that change? No?
Make it.
Doing it right now, because this is the one I did not. So that financial assistance policies are available.
So maybe in C, but in the future, the availability of financial systems, because that's where my confusion is. It's like, what's in the present and what's in the future?
So maybe that financial assistance policies for which the individual may qualify.
That we want you to know, that, yeah, whatever the right thing is, but that you may qualify for those in the future or something. I don't know.
I mean, we're not telling them exactly what they need to write in this letter.
No.
We're just telling them that the letter has to tell them about the availability of this.
Right.
So they could put anything they want as, hey, just to let you know, in the future, make sure. Does that make sense? Alan, are you?
Well, if you give them a warning that there's going to be maybe future money, this isn't a one-time thing.
No, this is nothing to do with.
Saying we
money.
paid off your existing debt, and just so you know, in the future, you may be eligible for financial assistance through the hospital that would make your financial responsibility little or nothing.
Mhm.
So you wouldn't have to have a medical debt that would need to be abolished.
Yeah, go through the.
Sort of.
Yeah.
Oh, yes, help us help you in the future.
It's not promising that this program is gonna exist.
Right.
It's more like educating them about other pathways of getting there, preventing that, yeah.
Yep.
And if we don't like what they write, we could
I don't
weigh
know
in
that
on it
we'll ever
next
see
year.
it.
Huh?
I don't know that we'll ever see it necessarily.
Well, aren't we all gonna get it?
Um,
I don't know.
Is,
Maybe I'm projecting.
is the percentage discounts that are listed here, are they already in effect?
Yes, they're in statute. They're in that 18 PSA 9482. Yes, that's where those come from. We changed it a bit, but I'm putting the same track. All right, we'll look at the other piece and we can always revisit. So the other piece is in this idea of pulling the credit reports. And so in section 4, there's notice to Vermont consumers about that nobody can access their credit report without their permission except under certain circumstances. And we'd added where that request is from an organization, a tax exempt organization for purpose of determining eligibility for the abolition of medical debt. And then in section 5, so we're not changing anything about what the notice to the or disclosure to the consumer would say, but just from a practical standpoint in 2480, where it talks about the exemptions from having to get consumer consent do not apply. And it would still say shall not apply to an organization that is exempt from taxation under the 501, section 501c3 of the IRS code when determining eligibility for the abolition of medical debt. But it would add, provided, however, that the exemption from the provisions of section 2480 of this title shall not apply to a tax exempt organization that is a large healthcare facility as defined in the patient assistance and financial assistance and medical debt chapter, really the definition, which is hospitals and ambulatory surgical centers, hospitals, affiliated outpatient clinics, and ambulatory surgical centers. So if there is a nonprofit, all of our hospitals in Vermont are nonprofit. So that doesn't allow them to pull people's credit reports without their consent. This is really focused on the organization determining eligibility for the abolition of medical debt. And I believe that was a concern the Healthcare Advocates Office brought to you.
Does that make sense to everybody? Okay. Looks nice.
Yeah, can or with- just wanted to confirm with the representative of the office that things looked as expected.
All right. So back on to the one that you just amended.
Yes, and I can put it up with the amendment now, and we can look at whether there's lead-in language that would be clearer. I'm actually just going to put it up from the Word document because you can see the change.
And just to be clear, this is a strike all of
It is strike all at the moment.
seven, and but the only changes that we've actually made to the whole of the bill are these two yellow pieces.
Right.
Okay.
It's a 6-page bill, so, I think you could go either way, strike all or instances of amendment. Okay, so we have notifying each individual what the entity is going to do. The entity with whom the treasurer is contracting will do a few things, and one of it, which is notify each individual whose medical debt was abolished pursuant to this section, the amount that was abolished, and which providers, the estimated percentage of the federal poverty level that corresponds to their income, and that financial assistance policies are available at all Vermont hospitals in accordance with 18 VSA 9482, including the following minimum discounts.
Yeah, Woody.
What are we talking about when we say the treasurer will reach out to the healthcare providers? I don't understand that first sentence. Purchase the medical. No.
Which first sentence?
On page 1.
Okay.
Line 16.
Okay.
What do we?
So if we back up to the beginning, the money is being appropriated to the treasurer to contract with a nonprofit to
Right.
acquire and repay medical debts. And then it's got some requirements on what the treasurer will ensure that the entity is going to do certain things, that the entity will purchase the medical debt of eligible debtors from healthcare providers at fair market value.
So
It's not the treasurer, it's the entity. It's just on the treasurer to make sure that that's what they're doing.
And where's the treasurer going to get this list of, will he or she have this list of healthcare providers that'll provide the debt information?
I think one of your witnesses addressed that yes, they work with
Okay,
the hospitals and other providers.
okay.
They do Deb and Green, they do like a file transfer, a data file transfer.
Any other questions on the bill as a whole? All right. What version are we?
So this will be, I'll need to make this 1.2.
Ready. Anyone like to make a motion?
So we've had 2 motions.
Oh, okay, yeah, well, let Mara, you make the motion.
This motion on a straw poll to accept the amendments to S27. Straw poll.
All in favor? 11-0-0.
And so what's the draft number? I can make the motion.
1.2.
1.2.
So I make a motion that we accept draft 1.2 and we recommend. I don't know if it's recommended, but I make a motion that we vote out draft 1.2 of S27, an act relating to medical debt of some kind.
As amended.
Yeah.
Clerk will call the roll.
At some point. My computer. Representative Chena,
Yes.
Representative Cordes, yes. Representative Critchlow.
Yes.
Representative DeMar,
Yes.
Representative Goldman,
Yes.
Representative Houghton.
Yes.
Representative Page.
Yes.
Representative Powers.
Yes.
Representative Rebecca.
Yes.
Representative McFawn.
Yes.
And Representative Black.
Yes.
And The motion passes 11-0-0. Been a while since we've had 11 years.
And,
The trend continues.
and the reporter of the bill. Do I have anyone who would like to report the bill?
Report.
Representative Page.
I second that motion.
So Representative Page will be.
So you're a little ahead of me. I sent it for editing while you were voting. It's okay. So I will get you a clean copy
Okay,
in a little bit. I asked them for an ASAP based on the two pieces that were highlighted. Moving quickly.
I need help.
Okay.
all right,
Wow.
moving on to S18.
So we have to send something to Betsy.
But yeah.
Yes, but not yet.
Okay. This bill
We
is
get it clean.
One of us needs to
overdue.
like.
See.
So going on to S18 and anybody else? I'm sorry.
Beyond
I
18.
don't believe we've had any changes since this morning.
That is correct. This one I had edited, still has highlighting in it. But I will take that out. There were no changes.
No changes.
What are we on?
S18
18 draft 1.3.
1 point what?
3.
Just checking.
I just wanted to see if anyone had any more questions. Or this is draft 1.3. Any comments, any? All right,
You wanted to look at again?
anything anyone wanted to? Guess not.
Any final discussion?
Okay.
I didn't realize this bill has been like hanging. Wow, I was so surprised.
Every year that I've been here, we've had a bill of this kind on the wall. It's overdue.
Kudos to everybody.
Is this a strike all?
This one is a strike all.
This is a strike all. Okay.
I mean, the other one was too. I think they all, no, S30 is not a strike all.
Would someone like to make a motion? I'm looking over
We
it.
have a struggle to accept the amendments to S18.
All those in favor? 11-0-0.
Somebody else want to move it?
motion that we adopt S18 as amended.
Oh, and when the clerk is ready, she call the roll.
Representative Chena,
Yes.
Representative Cordis. Yes. Representative Critchlow,
Yes.
Representative DeMar.
Yes.
Representative Goldman,
Yes.
Representative Houghton,
Yes.
Representative Page.
Yes.
Representative Powers,
Yes.
Representative Rebecca.
Yes.
Representative McQuan,
Yes.
Representative Black.
Yes.
Another 11-0-0.
Yeah. That was good. Thank you, everybody. for that. We did a lot of work on that. Yeah.
That was my thing. I'm really proud of you guys. That's a. I'm sitting well in that thing.
A report.
I do find it ironic that it took 9 years. of
7.
Being here. Oh, was it 7? Oh,
That's what Gail said, right? 7?
it wasn't
This is the
introduced.
7th year.
Oh,
Why didn't it?
We report it.
I would
Just curious why.
love for the reporter of this bill to be Representative Goldman. I was thinking it was a little ironic because we changed language around APRN so I'd love an APRN to do it, but not the kind that can do this. So, just be clear. Because it's in this bill now All right. So the last bill is S27. And no, not S27, S30, yes. This is the rewrite of the chapter 8, or VSA chapter 107. And no changes since we last spoke.
Changes since this morning when we looked at an amendment that would, adding an instance of amendment to move the effective date from January 1st, 26 to September 1st, 25.
And where this is a strike all is.
This is not a strike all.
This is,
No,
yes.
but I
There were amendments.
amused myself with before.
Strikeout amendment.
It's, there are instances of amendment.
So that would be favorable.
Fleeting
favorable
moments.
with Amendment.
Yep.
Okay.
And if I could make a comment before, I would hope that the committee would support this in recognition of what could only have been the most enormous amount of work this past year for our legislature.
Yeah.
So thank you for that. And your colors were beautiful. Whole thing.
Into the chaos in my brain. All right.
If I report this, is it okay to send out the color coded thing to everyone, or is that? It's on the record.
Fine. I mean, it's on the
I
website.
probably would, because I would rather people have a chance to read the 213 pages and figure it out than ask dumb questions. Although they probably still will.
No, they're gonna get overwhelmed. They're not gonna deal with it.
All right, so just to remind you, the three instances of amendment, the first one is adding back in some inadvertently dropped language from the standard policy provisions in existing law. Specifically, this paragraph beginning with the foregoing policy provision and ending with incontestable in all caps. Second instance of amendment is again adding language that was inadvertently dropped from the database, and that is or in lieu thereof in a section on the standard optional policy provisions. And the third is striking out the effective date and putting in a new effective date of September 1st, 2025. That's it.
Would someone like to make a motion?
Move that we take a straw poll to accept the amendments to S30.
All those in favor?
You can't see online right now who's in favor.
I'll take it down.
Just noticing.
1100 will verbally indicate.
Yes.
I saw 11 names. Raised hands. Some of you, I saw your other names.
And this is Representative Gina.
We haven't voted
Yes,
out.
we haven't
have we?
voted.
Oh, yes.
Yeah. Objective or anything. Spoiler alert. It's gonna be-
I move that we pass out of committee, S30 as amended.
The clerk is ready. She's gonna call the roll.
Representative Gina.
Yeah.
Representative Cordis. Yes. Representative Critchlow.
Yes.
Representative Demar.
Yes.
Representative Goldman.
Yes.
Representative Houghton.
Yes.
Representative Page.
Yes.
Representative Powers.
Yes.
Representative Rebecca.
Yes.
Representative Vaughn.
Yes.
And Representative Black.
Yes.
They already wrote down 1100.
Legislative council would not have been happy with a no vote.
Hey, no, you know,
There's
however you want.
All right, I think we're done for the day.
Wait, so I am doing this one. right?
Oh, I'm sorry, and the reporter of this will be Representative Chena.
And is it okay, Ledge Council, if I just coordinate with you a little, since this is such an epic thing? And I will do what I'm gonna do is I'll make a list of like questions and then give it to you maybe tomorrow so that there's some time.
Great.
Okay, thanks.
Yes, and you may also, Senator Hardy was the reporter in the Senate, so
I can ask her what she.
Yes, you may
Listen
wanna-
to her presence.
yeah, we can just check in with her to see
And Woody,
her take.
Brian, and Leslie, I'm gonna send an email right now to the clerk's office to let them know that you'll be sending.
You
Then
have to
emails.
deliver something there.
Yeah, I'll tell you what after we.
Okay, and so I will send all of the clean versions to the reporter, the clerk, chair, and Kristen. Okay, that makes sense?
All right, oh, Leslie, did you have a?
I'm just looking at tomorrow, so we just voted out medical debt, so we can take that off our agenda?
Yes.
Does that mean we're free the rest of the week?
That's what I'm wondering.
Please say
Can I go
yes.
home?
Yes,
take
and
universal
I
health
will
bill.
say also that I'm intending that we will be done by noon tomorrow.
Can we stay late
I
and work
thought
on,
you all would be excited about that.
can we stay late and work
You
on
can stay,
universal healthcare?
you personally can stay as late as you wish, but,
That's when I started liking you.
we can go.